We are all here today because the Empire Matrix Plan will no longer be available after December 31st of 2017. And I think we can all agree that change can sometimes be difficult, complicated, and confusing. So our goal today is to help educate you all about the alternatives that are available so that you can make the best possible decision for yourself. Okay, first of all, for those of you who are actively still working at the district, once the Matrix Plan ends, you will automatically be enrolled in the new PPO through Empire with ESI as your pharmacy benefit if you do absolutely nothing. So doing nothing is always a choice. So if you do nothing, that is where you will land effective January 1st. You may decide that that's not where you want to be and that you would like to enroll in the CDPHP EPO plan. You will still have ESI as your pharmacy benefit there. That will require you to take an action of enrolling online via HR at hand. If you are a retired former employee but not yet eligible for Medicare, again, doing nothing is an option. And if you do nothing, you will automatically be enrolled in the new Empire PPO plan with ESI as your pharmacy benefit, effective 1/1/18. You may also choose to enroll in the CDPHP EPO plan with ESI pharmacy, and that will require an enrollment form. Anyone who's retired cannot enroll online at this point in time. You would have to do that with a form back to the district. Retired employees who are Medicare eligible, again, you also have the option of doing nothing, and doing nothing will automatically enroll you in the new Empire PPO plan with ESI pharmacy. You may also choose to enroll in the CDPHP EPO, which also will have ESI as a pharmacy benefit. That will require an enrollment form by December 15th, 17, back to the district. You also have the ability, because you have Medicare, to choose one of the district's Medicare Advantage plans. All the district's Medicare Advantage plans include their own pharmacy program separate from the ESI benefit. Those enrollment forms need to be back to the district by November 30th. Additionally, I think everybody here is obviously local, but I wanted to just address the fact in the video that if you are a retired employee with Medicare and you live in the Capital District area and you want to enroll in one of the Medicare Advantage plans, you have choices there. And if you live outside of the Capital District and want to enroll in a Medicare Advantage plan, you still have choices, but they are fewer, obviously, as you can see. So if you're in the area, the Medicare Advantage plans are Empire's, Blue Shield of Northeastern New York, CDPHP has 2, and MVP has 2. If you're outside the district, you have Empire Medicare Blue, MediBlue, and the Blue Shield Northeastern New York program to choose from. There have been some frequently asked questions. So between the time that you got your letter and were notified about the Matrix Plan ending, we got some questions, so we wanted to just kind of address some of them up front here today. One of them is, what will your costs be? The contributions to the premiums made by the district and yourself does not change. So whatever contribution percentage you are at, that will not be altered. What happens to your pharmacy coverage? Any pharmacy coverage will be through Express Scripts, and your copays will follow whatever bargaining unit you are or were a part of. Does the lifetime max under the Empire Matrix Plan carry over to the new Empire PPO plan? The answer to that is no. The new plan has no lifetime maximum. When Judy goes over that program, she'll talk more in detail about that plan. What do I do if I don't like my choice and I want to change? Changes to enrollment can only be made during open enrollment each fall for the coming new year, calendar year, or if you have a qualifying event, such as a permanent relocation, death, divorce, marriage, birth. And then the other question, once you do leave the Empire PPO plan, so if you're in the Matrix now, you move into the PPO plan, once you leave that PPO plan, then you cannot return to it. So for example, if you're in the Matrix now and you go into the PPO plan for the coming year and then next year you decide you're going to go into one of the Medicare Advantage plans, there's no returning back to the Empire PPO plan. Okay, the next item on our agenda is to go over the new Empire PPO plan for you. And to highlight some of the details, similarities, and differences about that, I'm going to have Judy Moore-Kelman from Empire discuss that with you.
And I think Cheryl started it when she said, change is hard. I'm not a big proponent of change. I'm like an old fuddy-duddy. I like things the way they are. But I am comfortable in saying to you that we want to make the transition smooth for you to go from Matrix to the new PPO offering. We also want to make sure that for most of the benefits where I could make them rich like they were on the Matrix plan, I was able to do that in a lot of the categories on the PPO. So I made sure that we had a really beefed up PPO for you guys where I could do that. So with my agenda, what I'm going to talk about is the Matrix plan withdrawal and the replacement with the PPO. So I'm going to give you some rationale of why we did that, to give you a better understanding why we need to make a business decision to withdraw the Matrix plan. I'm also going to talk at a high level the differences between the features of the Matrix plan and what the PPO is. And we have great comparisons that Key Services put together for us for today. And then the last thought I'm going to leave you is looking at the benefit summary for just the PPO. And also too with me today is my coworker Carol Strickus, and she's going to be talking about the Empire MediBlue Medicare Advantage plan. So when I'm done with my part, Carol will come in and talk about that other option that you have too. If you are in Matrix and you're not sure if the PPO is the right option for you, there's also the great Medicare Advantage plan that Carol will review with you. So you got your notices in the mail. As Cheryl said, okay, we've got the elephant in the room, let's just say it. Empire's no longer going to be offering Matrix. That was Empire's decision. That was not the district's decision. Matrix came about probably 30 years ago, and everybody had Matrix. At one time we had just a true indemnity plan. Everything was 80%. There was no participating providers. So we created Matrix 30 some years ago. Over the years, a lot of groups left the Matrix plan. A lot of groups. They went into when HMOs were starting to come into play, when EPOs and PPOs came in. A lot of groups went away and didn't want the Matrix plan. It was too expensive, for one. It didn't have a huge network of participating providers. Back then it didn't have wellness benefits. So a lot of groups made that decision. In fact, probably 10 years ago, we thought of withdrawing the Matrix plan because the enrollment kept dwindling and dwindling. So we kept it in because a lot of groups wanted it because of union contracts. Over the last year and a half, 2 years, that enrollment in the Matrix plan went from when we thought we were going to pull it, so many years ago, we had like maybe 10,000 members in it, down to the last year and a half to maybe 3,000, not a lot. So other school districts, and really it was the school districts that held on to the Matrix plan. Those school districts, and a lot of them were local, Matrix was already withdrawn because their renewal was in July. So Shenendahowa is the last group that we have on the Matrix plan, and it's going to be withdrawn. If you think of it, we made it a business decision because we can't support an old plan for, like, you have like 200 people. What we had before was maybe 2,000, close to that. From a business standpoint, we just can't support it, that small program, when we have hundreds of thousands of other members in our newer products. So we made a business decision. I just want to make it clear it was us and not the Shenendahowa School District that is doing the withdrawal. You received in your packet a withdrawal notification, And that included the benefit summary as well as some legal documents that the DFS, which used to be the insurance department, says that when you're withdrawing a product, that one, you have to notify people within a certain time, that the group has to like post that in certain areas, and if the people aren't working, you have to mail it to their house. There's also part of the requirements that falls under legislation that was named Ian's Law that says you have to offer something comparable. And if somebody has a major disability, there's options for that if the new plan is not comparable. That's just standard language. The new plan is comparable. Everything for treating a major disability is covered under the PPO plan. So I just wanted to talk about that letter that you received. What I want to talk about next is the features. And I think it's important to understand the concepts for the differences. And then we'll look at briefly, there was a couple of comparisons. One comparison was with the matrix versus the PPO. And then I'll leave off with just looking at the PPO because that's what I want in your mind, the last thing that you're going to look at while I'm speaking. So the matrix, when you look at the plan design, matrix is very complicated plan design. They used to call me the matrix queen because I could explain it and I understood it. And people are like, I just don't get it. It's such a confusing design because you had three components. You had a hospital, you had a medical surgical, and then you had an extended medical. Then you had the opportunity to see participating providers. But if you had an office visit, it didn't matter whether they participated or not. It had to go under the extended medical where it was deductible and coinsurance. So it was more complicated to explain to people and to have a good understanding of how that plan worked. With the PPO, much, much simpler design. You have a scope of benefits that's covered under the contract. You have what happens if the doctor or provider is in-network. And by in-network, I mean it's a participating provider. So if the doctor, if the hospital, if the ancillary provider participates with the PPO program, either locally or nationally or outside the country, that's an in-network benefit for us. In-network meaning they have the contract with us, they accept whatever our schedule is, and the member only has to pay a small copay. There's an out-of-network option too. The out-of-network option, and this is where it's going to act as extended medical. So with the out-of-network option, it acts like the extended medical. Doctor doesn't participate, hospital doesn't participate. That benefit is paid subject to the same deductible at 80%, and then the member can be balance billed. So within a single scope of treatment, you could be in, you could be out of network, depending upon whether the doctor participates or not. I can tell you when we have groups deciding if I'm going to offer a PPO, or if I'm going to offer we have another plan where we cut out that out-of-network piece, they always have us run a utilization report to see how many people were in network on the PPO. Without fail, hospital in-network is 100% in-network based on people's utilization. Outpatient hospital, outpatient treatment, 100% in-network because the network is huge. We have so many doctors, so many hospitals. On the professional side, high 90s, depending upon where the people are located, are in network with doctors that they see. Maybe some of you have already had a chance to go online and see if your doctors are in the PPO. They more than likely are. So that's the difference on the design. The network, Matrix was a very limited network. It was a new upstate product. So we only recruited doctors in the upstate region. So even though Empire's area went to New York City doctors were out of network for you guys. Where PPO, it's part of our PPO network. So New York City, you would be in network, whereas opposed to the Matrix plan, you would have been out of network. You have the huge national network called the Blue Card PPO network. So Ed, we were talking about you live in Florida.
Right.
Blue Card PPO network is all over the United States, that they're part of this larger Blue Card PPO network. So if rest assured that I know you're going to find your doctor is in the network, either locally or out of our service area. This was always interesting with the matrix plan. When it was started up, we just went to a doctor's office and said, here's our fee schedule, do you want to join? We accept that fee as payment in full, and we never looked at the quality of care of the doctor. Did they have infractions against them? We were like, you're going to accept the fee schedule, be in matrix. Now moving to the PPO environment, all the providers are credentialed, so we look at their education. We look to see if they have any infractions against them. We look to see that they have malpractice insurance. So they're all what we call credentialed, where they aren't under the matrix plan. Now, as far as the medical management program, medical management entails case management for people that are really sick with complex care coming out of the hospital, to have our nurses work with your doctors on some benefits to pre-certify, to make sure that the procedure you're having in what setting is appropriate. Under the matrix plan, that didn't exist back in those days when we created that. So there was no individual case management, there was nothing. You went to where you went, and we would look at claims on the back end. So you could have had something done, and when we look at the back end, we could have said, that doesn't meet medical necessity, that doesn't meet medical policy. We shouldn't have paid that. And we could go back and ask for the money back from the provider, or come back and ask for the money back from you. That was on the matrix plan. Under the PPO, there is a medical management plan. Now, this does not affect Medicare primary. You can have a case manager, you can have those types of things, but we're not going to require that you call us or your doctor call us if you're going to say have a hospital admission. We do have that for people that are not Medicare primary. So there's some benefits like inpatient care that we ask that you call. And this is pointed out in the material that we have for you where you need to pre-certify. Now, one thing I did do, normal PPO says that if a person doesn't call and pre-certify, we are going to put a penalty on that, a percentage. I removed that penalty. So I removed the financial penalty. But my non-Medicare people, if you go to the PPO and you'll have a list of what you need to pre-certify, I want you to pre-certify, because I want to have our case managers involved with you, or our condition care people involved with you to help you with your treatment. One thing, a point I wanted to make out that's similar, it's the same medical policy. Same medical policy on matrix, same medical policy on PPO. So what we said, would how many times we would cover a certain procedure, or something considered experimental, it's the exact same policy that we would make our decision on. So that's the same. So I think that's comforting too, to know that. You have the one handout that I want you to look at, and it's matrix PPO benefit comparison. So you had quite a few of them. If you have one where it shows matrix versus the PPO, if you can see a version of that, and we didn't put it up because you couldn't be able to see it anyways. So if you have a version that says matrix no longer available and PPO, that's the one I want you to look at. So everybody with me? Okay. So,
Yep, you're right.
so what Key Services did with input from us is we created these great comparisons. So wanted you to see the differences in the benefits. So you can see the first column is the benefits, matrix, what it will look like under the new PPO plan. So the first is just talking about the structure. So I already made that point that the matrix structure was very complicated with hospital, medical, surgical, and extended medical. So it was complicated on how that worked. So even if a doc parred under matrix, it didn't mean anything for office visits. With the PPO, it's cut and dry. If the doctor's in-network, they participate, it's an in-network benefit, and it's a small copay or no copayment. If they don't participate with a Blue Cross plan, it's going to act like the old extended medical where it's deductible and it's co-insurance. So if you look down, the in-network with the deductible co-insurance, under PPO, it doesn't even apply in-network. Out-of-network, on the PPO, the deductible is going to be $250, $500. So I matched that up with the extended medical on the matrix plan. One thing that we could not do was that lifetime deductible. We just could not support that. But what we have on the out-of-network side is that if I happen to go out of network, and you're going to be pretty hard-pressed to find a provider that doesn't participate, but say I did, I chose someone that I knew doesn't par with anybody, I have that right under the PPO plan to go. So I would pay the first $250, and then the plan would pay, once I met that $250, would pay 80%. This is only if you go to a doc that doesn't participate, would pay 80%. Once my $250 deductible and my 20% add up to $1,200, then the plan will pay at 100% of what the out-of-network allowance is. But remember, when you go out of network, there's no control what a doctor's going to charge. So that doctor can bill up to their full balance. One thing, if you just glance down at that comparison, what I'd like now by you guys going to the PPO is that you get only a small copay for the office visit. So it makes it easier that when you go in to your network doctor, all you're going to pay is $10 for an office visit copayment. Like I said, I beefed up all the areas, if you look on the next page, with the inpatient skilled nursing, physical therapy, speech therapy. I made those benefits unlimited. And a lot of them where it matched to matrix, where you didn't have to pay anything in network, it's a zero copay. So you can look that yourself at the comparison between the two and can see what the differences are. But again, I made sure that with areas that we could beef up, that we did it on your PPO so that you would not be losing any of those number of visits or number of days. And then lastly, you have the comparison, but this is the new world now with matrix going away. So the new world would be this PPO benefit summary. And when you come to the PPO, probably within 60 days after January, we'll have the PPO contract and what we used to call the benefit booklets, but they call the certificates. So this is the one you should really focus on. So the way it's set up is like the scope of benefits. This is what's covered on the left side. These are the benefits. How it's covered is if the doctor is in network or if they're out of network. So this is the one that we're looking at. Oh, Cheryl's got it. You got it? We need one more up here. Raise your hand if you don't have this one.
Thank you.
There was a lot of them. It was easy to miss. Sue's got some for you. Yeah, you're with me now? Okay, this is the one. It says PPO on it on the left, And this is the plan that's going into effect on January, that's replacing Matrix. So if you look at that, it says the benefit. So on the left, that's what I call the scope of benefits. This is what's covered under the PPO plan. The second column is in-network. So in-network, that means participating providers. So that means not only in-network are the doctors credentialed, they've accepted to accept our fee schedule as payment in full and only bill the member the small copay. And that's for if you see our deluxe, your PPO doctors in our 28 county service area, or if you see them outside of the area through the Blue Card PPO. That doctor is agreed to accept those plan benefits at that small copay or no copayment. The third is that you have the option, because it's a freedom of choice plan, you have the option to go out of network. So out of network means the doctor did not sign up with any of the Blues plans. It means they don't participate, which means they can bill you, just like under extended medical, they can bill you up front, ask for the money, and then have you or they will submit the claim, but they're going to want their full charge. So if someone happens to find a provider that doesn't participate with the PPO network, they would have to meet the deductible first, so which is the $250. We would pay the claim to you at 80% of our allowance, and we kept the same out-of-network allowance, that we would pay that at 80% up to our allowance. So you would be responsible if you went out of network, the $250 deductible, the 20% of what was less than our fee schedule, plus any amount that was up to the doctor's charge. That's what's called balance billing. So that's conceptual. I don't think I mentioned, because some people aren't used to like all these names, like the PPO means Preferred Provider Organization. You don't have to pick like an HMO where you had to pick a primary care doctor. You don't have to designate a primary care doctor. I wanted to just to add that for you too. I encourage you to have a primary care doctor, so you can have someone overseeing all of your care and then get you to the right specialist and get you in. Sometimes it's easier to see a specialist if you go through your primary care doctor. So you don't have to have them under the plan, but I want you to pick one. So you have the benefits here. You can see where it's been enhanced, where the limitations are. For my non-Medicare primary people, there's information on what needs to be pre-certified. So you have that at a high level, but remember, we want you to call in, but there's not a penalty if you do not. So this is the last one that I want you to have looking at now when you're making your decision. So if you have questions, you can call the number that's on your card, and the member service team can talk to you about your new plan that you're going to. And of course, I encourage you to sign out at empireblue.com, because there's a lot of health and wellness information. You can look at your claim forms. So I'm just going to put a plug in for that if you hadn't. There's also Find a Doctor, that you have that handout. So there's information on how to find a doctor locally and how to find a doctor through the Blue Card PPO plan.
I'm here to talk to you today about the MediBlue plan, which is the Medicare Advantage plan that's offered through Empire Blue Cross. So what is an Empire Medicare Advantage PPO plan? So similar to the PPO plan that's being offered through Empire for everyone, it's a national network. You can choose any doctor or specialist as long as they accept Medicare, and I'll explain a little bit about how that works. You can see any specialist without getting a referral, similar to the PPO plan, and we provide out-of-network services at the same level as in-network services. So that's where the Medicare Advantage plan is a little bit different. We have an in-network and an out-of-network piece to this plan as well, but the benefits are exactly the same, both in and out of network. The network itself is very similar to the PPO, the national PPO network that Judy just talked about, and it is also national. But the important thing to remember is that if the provider, if they're not participating with the Empire MediBlue plan, they can still see you. If they accept Medicare, you still have the same benefits for that out-of-network provider, as long as they accept Medicare. So to enroll in a Medicare Advantage plan, you have to be enrolled in both Medicare Part A and Part B. You have to continue to pay your monthly Part B premium. You have to live in our service area, but guess what? Our service area is national. So you can live in Florida, you can live in Arizona, you can live in California, or you can stay right here. You still have the same benefits. And you can live out of the service area 12 months throughout the year. You can't have end-stage renal disease, and you also have to be eligible for the group retiree health benefits, which I think all of you in the room are eligible for that. All right, so finding a doctor in the network, very similar to what you would do with the traditional PPO plan. The information is on our website, empireblue.com, and it's on the public site, so you don't have to be a registered member to look to see if your providers are participating. You can actually go find a doctor. You say that you are eligible for the plan through Medicare, not through your employer. You have to choose Medicare to get the MediBlue providers. And then you just click on MediBlue, and that will give you both local providers and national providers. So no matter where you are right now, if you're thinking about making a change, it's really important so you know what level of benefits you're going to receive to just check and see if your doctors are participating. And again, just remember, if they accept Medicare, you have the same benefits out of network. You can also call 1-800-810-BLUE. That's the National Blue Cross Association. They'll be able to tell you if the provider's participating. We actually give out provider directories. Most of the carriers don't do that any longer on the traditional side, but for Medicare, we do have provider directories available if you need to have something mailed to you. I'm going to briefly just go through the covered services. But basically, your primary care physicians are going to be $10 for both in-network and out-of-network, and your specialist visits are going to be $15. Again, you don't have to choose a primary care physician on this plan, but if you see a primary, like an internal medicine doctor, family medicine doctor, it's going to be $10, and then the specialist will be $15. There is no deductible on this plan for either in-network or out-of-network. For your inpatient hospital care, you pay nothing. And I can tell you in terms of participation on the hospitals, we're 100% participating as well nationally on the Medicare Advantage side. So you'd be hard pressed to find a hospital that doesn't participate, but either way, it's a $0 copayment. Your ER copayment's going to be $50 for both in and out of network. So I like this slide because we want you to stay well. So there is a preventative care and screenings portion of your contract where we don't want you to pay anything. So your annual physical exam, we want you to have that. Your mammographies, we want you to have that. Your colorectal screening, we want you to have that. And we don't want to charge you that $10 or that $15. So if it's considered a well visit and something that's considered preventative, then it's going to be no copayment to you. And that's both for in and out of network on that. There's also routine hearing services. You have a routine exam with no copayment. There is a $70 max benefit per year on that. And you've got a max benefit every 2 years of $500 for hearing aids. You have vision care. You've got a routine exam at also $0 copayment. Max benefit per year is $70. And then you have a $100 allowance towards your eyewear every 24 months. Your out-of-pocket max per year is $3,400. Everything that you pay a copayment for goes towards that out-of-pocket max. Pretty hard to actually reach it, but it's good to know that you're maxed at $3,400. And then finally, if you take one of the Medicare Advantage plans, like Empire MediBlue, the prescription drug is covered under this particular plan. You're going to pay no copayment for select drugs, whether you do it through the retail or the mail order. And what I mean by select drugs is there is a listing of drugs generic drugs that we prefer that you take. So if you are on one of those prescriptions, it's going to be a $0 copayment. Generics that are not considered select drugs are going to be $5. 15 for preferred brands, and then 35 for non-preferred brands. Non-preferred is also non-formulary. So for those of you who are not familiar with a formulary, every health insurance carrier has a formulary they want you to kind of follow. If you want to take a prescription that's not on that formulary listing, then you're just going to pay a little bit more money. And then the co-payments for mail order are double. So it's 10 for generics, 30 for preferred brands, and then 70 for non-preferred brands. All right, so before I exit, I just want to, I know this is kind of a confusing time. We're throwing a lot of stuff at you right now. I would tell you that we have about 50 or 55 of the Shenendahowa retirees enrolled under the Medi Blue plan. If you're having a tough time trying to make a decision about where you want to go, talk to your coworkers, talk to the folks that are currently enrolled on the plan, and you kind of pick their brains. We don't get a lot of complaints, if any. I think they're relatively happy with the plan, so I'd encourage you to kind of talk amongst yourselves and to your coworkers or your co-retirees to see if it's something that would be a good fit for you.
I'm going to speak to you briefly about a program through CDPHP that is also available through the district, and it is called an EPO plan. We have a lot of acronyms. I'm sure I know sometimes it drives us crazy. I'm sure it drives you guys a little crazy too. But an EPO plan really means an exclusive provider organization. So it's a way that they describe the network of providers that participate with their plan. In this case, CDPHP's network is national, so there are over 825,000 providers in their exclusive provider organization network. Because it is an EPO plan, there are no deductibles associated with it. And there is an out-of-pocket maximum, which is $7,150 if you're covering a single person. It is $14,300 if you're covering a family. That out-of-pocket max, I think that's a confusing term to people, so I just want to make sure everybody understands what that means. It means that after you pay whatever co-pays you need to for your services, whether that be an office visit, laboratory, hospital, and in a lot of cases those are very small co-pays or no co-pay, those all get added up and tallied up at CDPHP. You don't actually have to keep track of them, they do. In the event that you ever reached that dollar amount in co-pays in one particular year, that means after that point the plan would pay everything in full. You would no longer be responsible for making any co-pays. So think of that as a safety net or a protection that you have built into plans. Anytime you see an out-of-pocket maximum, that's what that truly is for you. It protects you against catastrophic types of expenses, okay? The annual benefit max is unlimited, so there is no limit, like you can only use $500 worth of benefit and then it ends. That doesn't exist in an EPO plan through CDPHP. The one thing the EPO plan does have is it has in-network benefits only. So as previously Judy and Kara were talking about the fact that there's in-network and out-of-network benefits, this plan is in-network only. And the in-network means the 825,000 providers, okay? That's their network. And it says other than emergency. So obviously if you have an urgent need to go to emergency room, it's not going to matter where you are, you're still going to be covered for emergency services. This plan has a $20 copay for most services, so doctor's visits, things like that. Hospitalization is covered in full under the CDPHP EPO, and there are prior authorization requirements attached to this plan. And my best advice is if you're having something done and you know about it ahead of time and you're not sure, pick up the phone and call and ask the question. The reps are more than happy to guide you through that and give you an answer as to whether or not anything needs to be prior authorized or pre-certified. If you were to choose the CDPHP EPO program, then the ESI would be your pharmacy benefit. ESI stands for Express Scripts, in case anyone didn't say that earlier. So I'm sorry, that's another acronym. The next thing I'm going to mention to you is some other Medicare Advantage plan options that are in the district that are not here and present today, but I'm going to touch on them so you know they exist. As Carol mentioned, in order to be eligible for a Medicare Advantage plan, you must have Medicare, both parts A and B. And you must live in the service area of the plan, a minimum of 6 months. Each plan has its own service area. Empire's happens to be national. The other offerings are not always national, so you need to look carefully at that. The CDPHP has 2 Medicare Advantage plans, both an HMO style and a PPO style. So as you might guess, the HMO style is an in-network style of program. The PPO has both in and out of network. Blue Shield in Northeastern New York also offers a Medicare Advantage plan, and it is a PPO style plan. Empire obviously offers their PPO as Carol described to you, and it's called MediBlue. Every single one of those Medicare Advantage plans offered through the district have their own pharmacy. Carol described the one under MediBlue for you. They are not all the same, they are different. So CDPHP's Medicare Advantage pharmacy benefit is different from Blue Shield's, okay? So if you want to look at that detail, we have the charts in the back for you. If you're in a Medicare Advantage plan through the district, you do not have ESI pharmacy anymore. That goes away, and you have everything combined in one plan, your medical, your hospital, your pharmacy, all together. They all require enrollment forms. If you're going to enroll in a Medicare Advantage plan, you have to complete an enrollment form. They have to be returned to the district by the end of November for 1/1/18 effective date. There is going to be a separate meeting for retirees who are eligible for Medicare that the district will be, and the carriers will be sponsoring. That meeting is to be held on November the 2nd this year. So watch for an invitation from the district. It will be at the Hilton Garden Inn in the Clifton Park Center Mall, okay? So be on the lookout for that to come in your mail. And if you're interested in the Medicare Advantage plans, that's a great opportunity for you to come and learn more. And if it's something you know you want to do, we can also, people there will be there to help you fill out the form too if you need assistance with that. Some things that we want to make sure that you're considering, and some deadlines, and just to make sure that everybody is clear on what they do need to do or don't need to do. Think about who you're covering come January 1. Are you covering just yourself? Are you covering you and a spouse? Or do you still have a family to cover? Where will you be living? Will you be living here locally? Or do you have plans to relocate in 2018? Have you checked to make sure your doctors and hospitals participate in the plan that you intend to be enrolled in after the first of the year? Do you understand how any of your known medical and pharmacy needs are covered by the plan you want to be enrolled in? Obviously, everybody wants to know what costs are. You should be considering whether yourself or any of your dependents will be Medicare eligible, if they're eligible now, or if they're going to become eligible in 2018. So there's just some practical things to be thinking about when you make your decision. So again, just so that everybody's clear, anybody in this room, because you're all in the Matrix plan currently, if you want to be enrolled in that Empire PPO plan come January 1, you don't have to do anything. You can just go on your way today and have a great day. You may want to look up your doctors. You may want to ask a question of one of the reps here about a particular personal concern. But certainly, you don't have to do anything. We're going to automatically move your enrollment into that plan. If you wish to enroll in the CDPHP EPO, you need to do so during the open enrollment. If you're an active employee, you need to do that via HR at hand, online. If you are a retiree, you will need to use an enrollment form and return that back to the district by December the 15th. I would encourage you to return it as soon as you're ready to do so and not wait till the 15th, just so that the processing can begin. Either way, whatever you decide to do, you're going to get new identification cards. So you're going to need to watch your mail the end of the year. You're going to get new medical ID cards, okay? So just be checking your mail. They sometimes come under separate cover, okay? So just be sure that you're watching for them. If you are a non-Medicare retiree, so someone who hasn't reached the wonderful age of 65 yet, again, you're going to automatically move into the Empire PPO plan if you do absolutely nothing. If you wish to enroll in the CDPH PPO plan, again, it's an enrollment form back to the district by December the 15th at the latest. And again, you're going to watch for new ID cards as well. If you are a retiree with Medicare and you want to move and be placed right back into that Empire PPO plan, nothing for you to do at this point. If you decide that the CDPHP EPO plan fits your needs, you're going to use an enrollment form and return it to the district, but you need to return your forms by the end of November. Medicare has a longer processing time, so therefore they need to be back sooner. That way you will have your new ID cards again for the new year. Any and all of the Medicare Advantage plans also require an enrollment form. Do not mail them to the carriers. Please return them all to the district, okay? So don't do that. We've had some go astray in the past, so we don't want to see that happen to you. Make sure you return any enrollment forms to the district office. We're going to move into the section of the presentation where we're going to facilitate some group questions and answers. The question is related to the item called silver sneakers. Okay, so the lady would like to know under what plan would you have silver sneakers? So I think Carol's going to be best to address that.
I'm actually glad you asked the question. That is a value-added feature for all of the Medicare Advantage offerings here at the district, including Empire Medi Blue. And I did bring a brochure that's in the back that describes that. If you're in the Matrix plan today, or the EPO, CDPHP EPO today, those carriers don't offer that. The Silver Sneakers is just for the Medicare Advantage plans that are offered to the district.
Okay, so silver sneakers is something that's only available under Medicare Advantage plans. Okay, so the lady's question is in regards to the new plan and if she's able to submit her pharmacy receipts for reimbursement under the new Empire PPO plan. So I'll have Judy respond to that.
Okay, the answer to that is no. That component is going away. With the PPO plan, it's now being partnered with the Express Scripts pharmacy plan. So you will not be able to submit prescriptions under the new PPO plan. You have to use your pharmacy card now.
I'm just going to say the question again is in regards to the Empire PPO plan and in regards to how pharmacy costs are counted in the out-of-pocket maximum, correct?
Correct.
Thank you.
Okay. The answer is no, it would not. Your scripts from right now, if you move to PPO, you're going to have Express Scripts with that copay. That's a separate plan. We would not have that as part of your out-of-pocket max. And I can see where that needs to be corrected on a lot of times we don't have a separate, thank you, a separate out of network or drug program. But what we're also talking about here, so it's not your scripts that you get in retail. The scripts you get in retail, that's going to be under your Express Scripts and those co-payments. But there's certain pharmacy that you would get at your doctor's office. Say you're being treated with an injectable that's billed under the medical plan. So that's what that means. So if there was any cost share for that injectable that you get in the doctor's office or the hospital, that's where that would fall under.
Thank you.
Well,
Okay, so the question was in regards to how things work when you have Medicare and you're submitting to both Medicare and Empire Blue Cross.
Well, and if your provider is not participating in that.
And if the provider's not participating in Medicare, and the answer is you would still follow the same process that you do today.
and we have Bobby Joe Fernandez with us today. Some of you probably know Bobby. Bobby is teamed up with me on the Matrix plan, and she is well-versed on the benefits. So we'll have Bobby come on up because we're videotaping, so we would like to see your lovely face.
Okay. I just wanted to clarify that answer, because if your provider is non-participating in Medicare, it would still be submitted to Medicare, and we would pay secondary. If your provider is an opt-out provider, Correct. Then it would come to us directly for primary coverage with us.
No, the question is in regards to how do I access pharmacy benefits after the first of the year. If you are enrolled in the Empire PPO plan, that's replacing the Matrix plan, then you will have Express Scripts for your pharmacy benefit. They have both retail locations as well as mail order. So yes, you could still go to a regular pharmacy. You're not restricted to just using mail order. Thank you. Okay, the questions regarding lab tests and specifically cholesterol testing.
That cholesterol testing, that falls under the umbrella of preventative care, and that's where it would be no copayment. It's part of your routine annual exam. If you look at the back page of the benefit summary, it indicates what's required for prior approval.
And the answer to that is yes, if you are not Medicare primary. If you're not Medicare primary, the prior authorization piece of the PPO does apply to you. If you are Medicare primary, it does not apply to you.
So if you look at number 5 on the back of the page of the PPO summary, that indicates what services are subject to pre-authorization. So on the last page of the PPO benefit summary, and again, this is only if you do not have Medicare. So that lists out what's required.
Okay, so I'm still working.
Right,
Okay.
and you're not Medicare. So if you were gonna have physical therapy, or say you're having say you're having your gallbladder out, or if you had like complications and you're gonna be admitted, you have to call ahead and pre-certify that. Or if you're going to have physical therapy, you would have to call and have that pre-certified ahead of time. There's not a penalty if you don't, but you really need to have that pre-certified.
Okay, so is that the same for a second opinion?
Second opinion, no, you don't need to pre-certify a second opinion. I'm looking at the chart now. No.
And if we could just go back to your lab question for a second, there is no copay at all on any laboratory work under the PPO. So whether it's routine or not routine, there's no copay.
And so lastly, is there a yearly maximum, will there be a yearly maximum to chiropractic care, and is acupuncture included?
Do you want me to? Yeah.
Yeah, so your chiropractic visits do not require prior authorization until after your 5th visit. After that, after your 5th visit, your chiropractor will do the prior authorization for you. Acupuncture, there's no prior authorization, and it is a covered benefit. It absolutely is, yes. No, your initial visit for physical therapy does not require prior authorization. You'll just take that script, you'll go to your physical therapist, they'll do your evaluation, and then they will call for the prior authorization.
The question is, the lady's asking about the Empire PPO plan, which if you do nothing, you will automatically become enrolled in. And she spends part of her year out of this area down in Florida. And she wants to know about if the providers down there are going to be considered in-network or out-of-network. So I'll let Empire folks talk about their network again. It's very broad.
So if the out-of-area provider is part, and I got a big mouth too, you couldn't hear me. If the out-of-area provider is part of the Blue Card PPO network in Florida, in Boston, Texas, Arizona, wherever you are, that is like seeing an in-network doctor here in our service area. So what you can do, you can either go online and check to see if your Florida doctor is part of the Blue Card PPO network, which they probably are, but just to confirm so you have peace of mind. Or you can call us and we can check for you. Or you can call your doctor's office in Florida and just confirm, are you part of the large Blue Card PPO network? And what you'll see when you get your identification card, there's a suitcase with a PPO in it, And that signifies that you have that benefit for when you're out of the area to see Blue Card PPO doctors and they're in-network.
The question is in regards to pharmacy and to the ID card for pharmacy. If you're already in Express Scripts now for your pharmacy benefit, you can obviously that card is still valid. If it's something that you're going to be new to and you don't have that now, then you would be getting an ID card at the end of the year.
But if you have it, you're all set.
If you have it, a card, you could continue to use that card at this point.
Yep.
Okay, the question is in regards to the out-of-pocket maximum under the matrix plan. That's $6,250, $6,250, not
Right.
$62.50. And for those that may have met that previously or already, and how that applies in the new world. The new PPO plan does not have that out-of-pocket maximum. That doesn't exist in the new plan. And it does not, it doesn't carry over, if that's the right way you were trying to think of it. It does not carry over because there's nothing to carry it over to. It does not exist any longer.
So we start over on a $2,000 or $1,000 individual, 2,500 family,
Only if you're using out-of-network.
only if you're using out of network.
Correct.
If you're using in-network, it's
And that's the in-network out-of-pocket.
a moot point, is what you're saying. There is no more
Make sure I understand.
deductible co-insurance. If you're
Okay.
in-network.
So if I understand your question right, you're asking if there is a deductible or in-network co-insurance in the network,
in-
under the new PPO plan?
Yes.
Okay.
No.
There is not.
Okay.
But there are co-pays for every
Yeah.
visit though.
There
I
is a
realize there's a
copay for
copay.
services, it's a small $10
Yeah.
copay, yes, or some of the copays are zero depending on the service.
So if you look at that in-network maximum out-of-pocket, where once you have all those copays add up, I mean, the copay on office visits is only $10, so you would have to go to the doctor 100 times that year before those $10 would reach that 1,000 max. I mean, if somebody is really sick, but I've been with people that were really sick and going to the doctor's office a lot, I know they never would have reached that. But that's a protection there that Cheryl was explaining, that, say you did meet that. You wouldn't have to, once you met that out-of-pocket, it's under healthcare reform. Once you meet that in-network maximum out-of-pocket, you don't have to have any more out-of-pocket expenses for you, for the individual.
Okay, blue card, I will let Empire talk about the blue card, that's a very good question.
Okay, Blue Card is referring to the networks nationwide. So all Blue Cross plans are separate entities, we're separate corporations, but what pulls us together is the Blue Cross Blue Shield Association. So we each operate separately, and then in this area, it's unique that we happen to have, you know, a lot of Blue Cross plans overlapping their service territory, like we overlap with Northeastern New York, and then there's Excelis. But Blue Card is the marketing brand, if you would, that touts our national networks. So it's the Blue Card PPO network. So when you say Blue Card, that's just talking about the national network. So that if you were in Texas, or if you were in Florida, if you wanted to go, you know, say Dana-Farber or, you know, John Hopkins, that would be called the Blue Card PPO network. And Blue Card means it's part of the national network, that you happen to be a New York Empire member who's seeing a doctor in that service area under the Blue Card family. And that's going to be an in-network doctor for you.
And that's with the PPO.
Yeah, that's with the PPO, and that's what Blue Card means.
Okay, the question is in regards to how does the new PPO plan interact with Medicare in terms of payment? So I'm gonna let Bobby Joe talk about that.
So this is a generalization But if something's not medically necessary under Medicare, like you're saying with the chiropractic care, Empire wouldn't pay for it under the matrix, we're not gonna pay for it under the PPO.
Yeah. So the question, just so everybody could hear it, is regarding an annual physical exam, if I understood you correctly, and how that's handled when you're in the Medicare, when you have Medicare, and when you're also in the Empire PPO plan.
So in that situation, it's not that your physical is not medically necessary, because it absolutely is, and it's 100% covered under the PPO. So if it's not gonna be covered by Medicare, it's gonna go on over to Medicare, it's gonna deny there, it's gonna cross right over to Empire, and we'll pay it as primary. You're allowed one physical a year under the PPO, so.
Okay, so the question is in regards to what your out-of-pocket costs were after you reached a certain threshold under the old matrix plan, and how that then is handled under the PPO plan. Okay.
So, under the old matrix plan, office visit was under the extended medical, so it didn't matter if the doc participated or not. So if you had the matrix plan, you had an office visit, you would have to first satisfy that $250 deductible. And then once you met that $250 deductible, then the plan paid at 80%. You did have that lifetime max under the matrix where once your 20% added up to a $6,250, then you didn't have to have any coinsurance. Well, that's no longer in place. Under,
I thought it was every year, you started off with $250, but then all appointments afterwards were, don't pay now.
that, if you, under the matrix plan, if you had already met that lifetime maximum of coinsurance, then that was the case, that you would have to meet $250 first, and then you didn't have anything after that. That's going away. On the PPO plan, your office visits are, if their doctor is in network, it's only going to be a $10 copay. So that would be 225 visits under the old plan. So not many people go 25 office visits a year. Not many, some do, but not many. The out-of-network piece, if you see an out-of-network on the PPO, it's going to be the $250 deductible, and then the coinsurance is 20% up to that out-of-pocket maximum. So between that $250 deductible and those 20%, once they add up to $1,200, then for non-network doctors and providers, then we'll pay it 100% out of our network maximum allowed amount, but you would still be responsible for the balance bill. I think once you look at the doctor's network, I really think most of you are going to be in network, that your doctors are in. 100% of the hospitals participate in our area. Outpatient, they participate. There's some holdouts that don't want to participate with anybody on the professional side. So, but you're going to be, as I've been saying, hard pressed to find one that doesn't. I guarantee most of you will be in network, where it will only be that $10 copay, and that you won't be over on the out-of-network side.